Every year, millions of seniors walk into clinics for routine health checkups, blood work, scans, procedures, all in the name of prevention. But what if I told you that some of the most common tests, which tests your doctor may casually recommend, could quietly do more harm than good? New research shows that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or even lifelong side effects. And here's the part no one talks about. Almost 99% of people over 70 don't realize they are being overtested. One of these so-called routine checkups, the number one on our list today, actually causes 5% of all cancers in the US, about the same as drinking alcohol every single day. You won't see this truth on a billboard, you won't hear it in a TV commercial. But today, we're uncovering the 5 health checkups you should think twice about after 70, all backed by science, real patient stories, and solutions you can use instead. Before we begin, let us know in the comments. Have you ever regretted a medical test or treatment? Do you feel seniors are tested too much? We reply to every single comment with personalized tips. And don't forget to like this video and subscribe for more health videos like this. Now, let's dive into the first test. It looks harmless on paper, but it can ruin your quality of life in ways most seniors never see coming. Number 5, bone density scan, another named DEXA scan. It sounds harmless, right? A quick scan to check if your bones are strong. No pain, no needles, you walk in and walk out. But here's the hidden truth. After age 70, this test often causes more fear than benefit. The DEXA scan measures bone density to detect osteoporosis, but past 70, nearly everyone shows some degree of bone thinning. It's as natural as wrinkles or gray hair. The danger isn't in the scan itself, but in what comes after. Doctors often prescribe medications called bisphosphonates for even mild results. These drugs sound protective, but come with side effects like jaw necrosis, a rare but devastating condition where the jawbone dies, severe reflux and stomach irritation, brittle bones that may fracture in unusual ways. Here's a fact. A 2019 study in the Journal of the American Geriatric Society followed 1,200 women over 70. Bisphosphonates reduced fracture risk by only 0.3% after 5 years. In other words, the benefit was tiny, but the side effects were real and lasting. One patient, Rose, a 76-year-old retired piano teacher, is a perfect example. She walked daily, had no pain, no history of falls. After a scan, her doctor labeled her with osteopenia, a mild condition. She was immediately started on medication. Within 3 months, she developed severe reflux and jaw pain. She stopped playing piano, the one joy that kept her spirit alive. When she came to us, we stopped the drug and started her on weight-bearing exercises, vitamin D, and calcium-rich foods. A year later, she was back to performing recitals with stronger legs, better balance, and no fractures. So, is the scan always bad? Not necessarily. If you've had fractures, unexplained height loss, or sudden bone pain, it's useful. But for most healthy seniors, lifestyle changes, walking, light strength training, vitamin D, and a calcium-rich diet reduce fractures by 20% or more, according to Osteoporosis International 2022. So keep in mind, don't let a number on a screen control your life. But as scary as that sounds, the next test can lead to something even worse, brain surgery. Number 4, brain MRI for memory loss. Forgetfulness is frightening. Misplacing keys, forgetting names, it makes many seniors think of dementia or Alzheimer's. Doctors often respond with an MRI. Sounds reasonable, right? Let's see what's happening in the brain. But here's the reality. Most brain MRIs in seniors show age-related changes, slight shrinkage, or tiny white spots. These findings are normal. Yet, once they're on paper, panic sets in. In fact, a 2021 study in Neurology Today reviewed over 3,000 seniors aged 70-85 with mild memory complaints. 86% of MRIs showed abnormalities. Only 3% of those findings were linked to treatable conditions. Yet 12% of patients were pushed into invasive procedures like spinal taps or brain biopsies. One patient, George, a 74-year-old retired engineer, came in after forgetting names more often. His doctor ordered an MRI that showed white matter changes. George panicked. He stopped driving, stopped going to church. His life shrank in fear. But when we tested him with a simple memory screening, his score was perfectly normal for his age. His abnormal scan was actually just aging. With reassurance, hydration, better sleep, and daily brain games, George returned to his old self in months. So here's the truth. Unless you have severe neurological symptoms like seizures, sudden behavior change, or rapid memory decline, an MRI rarely helps. Cause a better first step. A simple paper-based memory test. It's cheap, quick, and far less terrifying. Still with me? Because the next test is one you've probably had, and it often ends in unnecessary surgery. Number 3, cardiac stress test, chest tightness, fatigue, shortness of breath. Doctors often order a stress test where you walk on a treadmill while your heart is monitored. But here's the trap. After 70, these tests are notoriously inaccurate. False positives, where the test suggests heart disease when there isn't any, can be as high as 40%. That false alarm can lead to angiograms, stents, or even bypass surgery. All risky procedures don't always improve survival. So, a major study in JAMA Cardiology 2017 found that more than half of stents placed after stress tests were unnecessary. The patients had no improved survival, but higher rates of bleeding, kidney damage from dye, and long hospital stays. One patient, Raymond, 75, walked daily. He felt tired on hills, so his doctor ordered a stress test. Results looked suspicious. He was rushed to catheterization. A stent was placed for a mild narrowing. That night, he developed kidney injury from the dye and spent 6 days in the hospital. The truth? His fatigue came from dehydration, not his heart. Safer options exist. For mild concerns, a resting EKG or a coronary calcium scan provides clearer answers with lower risk. Still, nothing compares to what's next, because the test number 2 is considered a gold standard, yet after 70, it can do more harm than good. Number 2, colonoscopy. For decades, colonoscopy has been the gold standard in colon cancer screening. And yes, it can save lives. But after 70, the risk-benefit balance changes dramatically. Here's why. PrEP involves harsh laxatives, which can cause dehydration, dizziness, or kidney injury. Sedation increases the risk of confusion, memory problems, and falls. The procedure itself can cause bleeding or even perforation of the bowel. A massive study in JAMA Internal Medicine 2019 followed 1.3 million Medicare patients. Among those over 75, only 2 lives were saved per 1,000 colonoscopies, but over 20 people suffered serious complications. That's a 10-1 risk-to-benefit ratio. Patient story: Dana, 73, a bakery owner, was healthy with no symptoms. Her doctor insisted on a colonoscopy. A small polyp was removed, but that night, her bowel perforated. She spent 9 days in the hospital, lost weight, and never fully regained her strength. She'd already had 2 clean colonoscopies. It wasn't necessary. CompCare guidelines now recommend stopping routine colonoscopies at 75. Safer alternatives exist, like the FIT stool test, which can be done at home, no prep, no sedation, and very effective. But as dangerous as colonoscopies can be, the number 1 test on our list is even worse, because it doesn't just harm, it can cause cancer itself. Number 1, full-body CT scans. Some clinics offer full-body CT scans as part of executive health checkups. They claim to catch hidden cancers early, but here's the shocking truth. Full-body scans expose you to massive doses of radiation, 10 to 20 millisieverts, equal to 500 chest X-rays. A 2023 study in JAMA Internal Medicine concluded that CT scans may now be responsible for 5% of all cancers in the US. That's the same cancer risk as daily alcohol consumption. And even when nothing dangerous is found, these scans often detect harmless nodules or cysts. Once flagged, the fear begins. More scans, biopsies, even surgery. One patient, Marcus, age 80, strong and active, signed up for a senior elite checkup. His scan showed a tiny 3 mm lung nodule. He was sent for a PET scan, then a biopsy. The nodule was benign, but the biopsy collapsed part of his lung. He spent 2 months recovering all for something that never needed treatment. The American College of Radiology is clear. Full-body CT scans in healthy adults have no proven benefit, but enormous potential for harm. Always ask your doctor, if this test finds something, what's next? Will the risks outweigh the rewards? Real prevention starts with lifestyle walking, eating whole foods, staying mentally active, and sleeping deeply. Now, I want to hear from you. Have you or a loved one ever gone through a test that led to unnecessary treatment or side effects? Share your story in the comments. We reply to everyone. If this video opened your eyes, hit like and subscribe for more science-backed health truths. And in our next video, we'll reveal 7 medications seniors should avoid after 65 and the safer alternatives your doctor may not mention. Until then, stay strong, stay curious, and remember, sometimes the best medicine is knowing when to say no.